Hello and welcome back. Today I wanted to present an interview with Dr. Brandie Freeman. She's a doctor of physical therapy, and physical therapy is one field where I feel like a lot of healing in modern medicine, if you're looking for healing, especially things that are related with things that may come up in yoga, for instance, musculoskeletal issues, I think physical therapy is one of the best modalities for you to explore for healing. Some other modalities that are worth looking at: acupuncture, chiropractic, therapeutic massage for sure. But in a sense, PT covers some of what all of those other modalities do. Physical therapy covers them. So Brandie Freeman is a longtime student of mine. She's done the work. She's done lots of meditation. She is spiritually awake, for lack of a better way of putting it. And I find that that is a huge factor in actually receiving the proper care that you look for. In modern medicine, generally the way it works is you go through a program and you get certified. And modern yoga is the same way. And what I find is there are many people who have certifications who actually aren't really necessarily going to give you the best care. Same with yoga teachers. There are people who have the certification, they have the credentials, and yet actually you find that when you are working with them, the results are not really what they're supposed to be. So I find that healing, with healing especially, with spirituality, you need someone who's really awake. And Brandie is one such person. And what you'll find is going to a quote-unquote regular physical therapist versus someone like Brandie. You may get lucky. You might get someone who is very awake and who really is in it for the right reason. But what you find is a lot of the modern medical system with insurance and the way that everything is set up, it's not actually really designed with your healing and optimal healing in mind. So the system is really built around money and making profits for the institutions. This isn't a conspiracy theory. This is just actually a fact. So modern medicine, insurance companies, they're designed to make money. So whether or not you receive the best care or not, that is outside of that. Now, I want to be very clear. I'm not saying there aren't practitioners within those systems who are most interested in healing, and you'll find those people. So Brandie is one such person. She works on the outskirts of the system. She's certified. She has all the credentials. She's studied and gone through the program. So she's definitely going to bring all of the goodness that Western medicine has to bring. And yet she also is spiritually awake. So she's present with her patients. Her intention is in the right place. She's not just looking to make another dollar off of you. She really is interested in your well-being and outcome. So I wanted to interview her, and I may do some other interviews like this. Let me know in the comments if you'd like me to do that, where there are certain people who I know, who I trust, and who I think are spiritually awake and who are going to give you the best care possible. So these are people that I'm willing to sort of endorse. And so Brandie is somebody, if you are having issues, definitely contact her. She'll do a consultation with you, free consultation. She'll let you know whether or not it's a problem that she feels that physical therapy can help you with. But there are a rather large range of physical issues that can be helped with physical therapy, and Brandie is someone I can't recommend highly enough. She's worked on me, and the results are better than I could have ever hoped for. So again, highly recommend. She's a great person. She's a yogi. She's a certified yoga teacher at the 500-hour level. So as high as you can currently get, and also a physical therapist, an educator, and again, a wonderful person. All right, everyone, without further ado, here is the interview with Brandie. All right, so we're here with Dr. Brandie Freeman, and she's a pelvic floor physical therapist and a doctor of physical therapy.
Mm-hmm.
And so why don't you tell everyone in the community like what you do, just in general?
Well, sure. So pelvic floor therapy is a branch of physical therapy. So yes, if you have knee pain or your back hurts or your neck is causing you problems, I can absolutely help with that because I've had all of that training, but I've undergone several hundred hours of extra training. So for example, for pelvic floor stuff, when we say that, what we mean is the muscles in and around the vagina, reproductive organs, those that help us with continence and those that help us with bowel movements and stuff. So it gets kind of personal, but those are the things that really can impact somebody's life and really decrease quality of life. So when we think about the Mula Bandha and what that is, like that drawing up and that kind of core, that root of who we are, I really help to get to the root of those kind of problems.
All right, great. So in terms of like people coming to see you, is insurance something that you take, or how does that usually work?
Well, the thing about the insurance companies is whoever you're paying is generally the people that are concerned about your well-being. And I don't know about you, but I don't feel like insurance companies really have our best interests at heart. They profit billions of dollars a quarter. And what that often means for somebody coming in for, urinary incontinence where they're, sneezing and leaking, for example, if I were to take insurance, this would be a different setting. The room wouldn't be as private and quiet and safe. And then also, they would want me to see 2 or 3 people at a time, which, if you're having urinary or sexual issues, like what kind of environment really is going to help your healing and what kind of individualized care is going to be possible in an insurance-based setting. It's not going to be what we're going to be able to do here. And I'd be able to focus really on you and your problem and give you that kind of individualized help. So I'm out of network, so I can provide a super bill and get reimbursed that way. But no, I don't. And it's just for the person's best interest,
Right, yeah. So I imagine that there's a lot of restrictions placed on you and how you work and what kind of things you can do.
Yeah, a lot of times some of those things like if you're a female and you have discomfort with intercourse, some insurance companies don't think that is a legitimate medical code to reimburse. But that could be, the difference between someone having a baby or being happily married.
Mm-hmm.
And so that is a legitimate thing that people need help with.
Yeah,
but Blue Cross Blue Shield may not think so, so.
Yeah, it's interesting what they think is legitimate or not. I think a lot of psychological issues they aren't recognized.
Mm-hmm.
So
exactly.
they're just sort of like, oh, you're suffering, well, tough.
Yeah, exactly. I feel like the insurance is helpful, like if you have a major medical thing, but daily life, wellness, yoga, meditation, the things that actually will keep you well and keep you out of that surgery aren't covered. It's a broken system, I think. So I'm just trying to do my part to help people. And honestly, this is way cheaper than some of the surgeries that are available for the issues. And then you actually get stronger and feel better. So
yeah. So pelvic floor stuff, people can come see you for that.
Mm-hmm.
What sorts of other, thinking of like the yoga community, people who are practicing yoga, I know that I've told anyone who will listen that in the past I said I think you need a acupuncturist, a massage therapist, and a chiropractor as part of your team.
Sure.
I didn't know any PTs, nor could I necessarily afford it, but so PT, I definitely think that's in that same category. In fact, if you have a good PT, you might not need any of that other stuff.
Yes, that's very true.
Yeah. So why don't you share with the community like what sorts of things or conditions, like because I think that just like an automobile, like I think people think, oh, if I do yoga the right way, then I'll never have any problems. I won't But that's not really been my experience, nor do I know anyone who's had that experience. Yoga can help prevent a lot of things. It's not going to prevent everything. And also there are certain, I think, side effects of practicing yoga. As good as it is for you, it also can take a toll on a body as well. So it's sort of like your pit crew. If you're racing, it's not like you shouldn't race. You can race if you're in a car, but you're going to need a pit crew. Yeah. So it's like, do yoga, it's very good for you, but you're going to need a pit crew. You're going to need some people to help you keep this thing running optimally. Yeah. That's how I think of it. But what sorts of conditions can people come to you with?
Well, sure. So I can help people with their low back pain or their muscle spasm, just like, and I can draw a needle, which is not the same as acupuncture, but, we use the same kind of needles, but instead of going for energy and meridians, we look for those knots. Like if you have a knot in your shoulder and it just won't go away, like a needle will resolve that and you won't have that issue anymore. The difference between physical therapy and those other modalities, which they're great, like I go to acupuncture sometimes, I think it's awesome. Massage can feel wonderful. But let's say you're doing yoga and you notice that, your right knee is always bothering you. What I can do that they may not do is I'll watch you walk, I'll watch you do the yoga poses that are bothering you, and I'll check your strength, I'll test your range of motion, and I'll find the root of the problem, and we can say, okay, this is the exercise, this is the activities you need to do to fix that issue. Like it's probably hip weakness, but which muscle, and this is how you'll strengthen it. And then I can draw a needle your quad if it's coming from your quad, and I can do soft tissue work, so I can do all of the modalities, but I add an extra layer because of my training as a physical therapist. I can see the movement patterns and the actual range of motion and strength issues that are causing them.
And my experience with body work and healing work and all of those things is I find that practitioners very often, the quality of care that you get, and this is true also yoga teachers, the quality of care that you get, quality of the service that you're receiving varies a huge amount.
Sure.
So kind of this goes back to what we were saying earlier. Like you've set yourself up here outside of the sort of insurance, umbrella, so that you can work the way that you want to work and provide the kind of quality care that you want to provide. So maybe for people who've had some PT and maybe they've had a surgery and they've gone to PT and they're like, oh my God, like I hated it. They just put me on a bike for 20 minutes and then they left the room, did something else and came back, and I don't think I need that. I don't see how it's going to solve anything for me. So like maybe you can draw some contrast between like what you're doing and the kind of care you're providing, because it's just so huge. It's like night and day. It's almost like not the same thing. I've been to a chiropractor who wasn't good, and then I've been to a chiropractor who's good. Huge difference. Same with acupuncture, same with massage. It's like one, you're just throwing money out the window. It's the same, and I think yoga is the same way. Yoga, so you go to yoga and you're like, what was that? And then you go to somebody else and it's like, oh, this is yoga. So that's not, it's interesting because people can still get the certification, they can still get their credentials, they just jump through the right hoops, they get it, but they're not necessarily a healer.
Right.
Inherently.
And honestly, I do really, I do take on that role, and I do kind of embody that mindset of a healer, but also an empowerer. So the things that we do in here aren't going to be passive. So if you go to a physical therapy place and they put you on a bike for 8 minutes, the reason it's 8 minutes every time is because that's a unit that they can bill the insurance. And so I don't need you to warm up in order for me to help your pelvic pain or to help your neck. Like that doesn't make sense, right? So I'm not just going to run you through a list of exercises that each have coded a minute or two to get the right thing for your insurance company. So I'll say, what is your problem? I'll watch that problem. I'll see it in play in the situation that it's in. And then in this quiet, peaceful place where we really can come together to get to the root of what's going on, solve it. And I don't have to worry about, did I hit, 15 minutes to get something I can code for your insurance. It's like, what did you need today? Did you need a lot of manual work, or did we need to watch you? Do we need to go outside and watch you run? Do I need to come to your house, which I do home visits? Do I need to come to your house to see your stairs or to see how you pick up your child? So it's like, what do you need? Not what I need to put in my paperwork, but what is it that you need? So it is a little bit different. So this is not going to be where somebody's doing paperwork the whole time and you're just kind of running through exercises. It's going to be like the specific things that will help you get better and help solve the problem.
Yeah, that's great, because I think people out there without the education, they don't necessarily know how much trying to take insurance or staying within a certain framework ties your hands.
Yeah. Wow.
And so you're like you're saying, you're jumping through all these hoops trying to make sure that you can bill for this and that, versus spending the time just saying, what is your problem? Okay, what do we need to do to solve that problem?
Right,
and looking
right.
at that directly.
And I have a method where I'm going to calm your symptoms down and then get these new movement patterns that you need and then connect them back to what you're wanting to do. So, if you want to get back to yoga and get back to this pose, I'm going to calm those symptoms. I'm going to make sure you have that strength and range of motion to do it, and then make sure you're doing the yoga thing. And I'm a yoga teacher too, so I can watch that and actually know what Warrior 2 is. And if you go to an outpatient place where they're just running you through the bike, if you tell them that, camel pose is really hard, like they won't know what that means, so.
Yeah, so I think that's an important point. Brandie's a certified 500-hour yoga teacher as well, and she's been a student of mine for a long time, so she knows all about yoga and the kind of work that we do and the kinds of side effects that might have, or the problems that might arise, the types of postures you're trying to do, all that stuff. So she has a very unique, I think, background in that respect. Now, let me ask you a little bit about, I think many people know Maggie. She's a surgeon, and she generally recommends that you try everything else before you go to surgery.
Sure.
Right?
Yeah.
So maybe, I don't know if you could talk a little bit about, maybe there's some things where people are having problems and they're considering surgery that actually they could come to PT. They might find actually, I don't need surgery, even though there was so much pain there before, even though my doctor might have said this or that. I think a lot of surgeons and doctors, it's the old saying of, when all you have is a hammer, everything looks like a nail.
Exactly.
So if I'm a surgeon or I'm a general practitioner, most modern medicine has this, they have two tools, drugs and surgery.
Yeah.
But you have a much wider palette of what you can use. So I actually think, from my perspective, PT is probably the most powerful healing modality that sort of Western medicine recognizes at this point.
Yeah,
Would you agree with that?
And then I think that's a good point about Western medicine recognizing it, because there are some really amazing things that, like shamanic work can be super helpful, but, we're not there.
Right.
But
no, it's to me, your doctor's not going to recommend shamanic work.
No, absolutely not. So two surgeries that I see a lot of people either are about to have, or they want to avoid, or they had the surgery and it didn't work. The first one is bladder sling. So if you've had a baby or you've just been a very active person, a lot of times coughing, sneezing, lifting, even some yoga poses can cause urinary leakage, and so that's also a muscle problem. And some people will just, get your bladder kind of tacked up. This is a very painful, expensive procedure. And whatever underlying causes were there are still there. And so I'll see people after they've had it revised and they're still having the problem. And it's heartbreaking. So that is, if we said we couldn't lift our arm like this, would you get it sewn together like that?
Right.
Well, no, you wouldn't. So how about we don't do that with your pelvic floor? And then the other thing is back pain. So if you look at the data for back surgery, unless it's to the point where your leg doesn't work anymore, it's probably not a good idea. And I have a lot of specialized training in when we say sciatica or radiculopathy, but when the back pain is so bad it goes down your legs. I spent 8 weeks in Arizona with a nation leader in that. So we can get that resolved without you having to have your bones fused together. Because after that, then the bones above it and below it start to have problems. So, but yeah, sometimes surgery can be helpful.
Sure.
Sometimes.
Sure.
But it's not a good first line of treatment, because the first thing you're going to do after you have surgery, or you're going to get referred to physical therapy. So, like, just try that first, maybe.
Yeah, reverse it.
Yes.
Try the physical therapy first.
Yeah, exactly.
Solve the problem. Yeah. All right. And so you're a doctor of physical therapy. Now, are there different designations for physical therapists? Is that the standard, or how does that work?
So if you kind of go back in time, because we have added all these modalities, like dry needling, like pelvic floor therapy, all these different manual treatments that we used to not know how to do or weren't available. If you go back in time, like 25 years, a physical therapist would just have a bachelor's degree. And then they had a master's degree, and now we have to have that bachelor's and the doctorate. So, and it's because, we can provide so many services, and so many different things. We really need to know our anatomy. We need to watch people and see what's going on. We need to have it's a very large skill set. And so, a doctor of physical therapy is what everybody is that graduates today. But if you have someone that's more experienced, they may not have a doctorate, and that doesn't mean they don't know what's going on. Maybe they're actually awesome and have been doing it for a while. So
right,
yeah,
right. All right. So you're a physical therapist, but before you decided to do physical therapy, you looked at yoga therapy. So this is since we're a community of yogis, I think some people may have a problem. They think, well, I'm going to go see a yoga therapist. So could you contrast for us, like, physical therapy versus yoga therapy, what the different modalities provide, maybe their strengths or weaknesses, and sort of the difference there?
Sure. So yoga therapists are amazing. They can be very helpful, especially if you need some individualized yoga programming. They can watch movement. They can figure out what's going on and give you stretches and yoga poses. But their main modality is yoga. And so to build upon that, though, like if I notice as you're walking, your hip joint isn't moving, I can get you on the table and mobilize your hip joint. And like if it was pinching, it won't be pinching anymore. They can try to do that through a yoga pose, but I don't know that would be as effective as me getting into your hip joint and mobilizing it. And then the other thing is, because I'm a licensed medical provider, you can submit for reimbursement for your insurance company, and this would be something that I can do internal work. For example, like a chiropractor, acupuncturist, massage therapist, they can't do internal work. So if you have vaginal pain or rectal pain, like I can do that, and a yoga therapist certainly would not be able to do that. So those practitioners can be very helpful, especially for calming the nervous system and giving one-on-one care. But it's just like, I'm able to do that, but then a larger umbrella of things to really to get into the problem and solve some of the causes of pain or discomfort.
So you can do a lot of the things that a yoga therapist can do, but then you just have a larger umbrella that you can do. So where would somebody say, okay, I don't need a physical therapist, or I'm outside the scope of where physical therapy can help me? So where would that be, do you think? What sorts of problems?
Sure. So if I have someone come in and they have, it's unfortunate, but a lot of people that I treat that have pelvic pain, they often will have some kind of sexual trauma. I am trauma trained and I do trauma informed treatment, but it may be very appropriate for them to also see someone to speak with, whether that is a teacher or counselor or a therapist or a psychiatrist, whatever that looks like for them, but to have some kind of other mental health support. So that's kind of out of my scope. Also, sometimes people, like I can help people, for example, with erectile dysfunction, depending on if it's a pelvic floor problem. But like if their erectile dysfunction is caused by them having really high blood pressure and then there's capillary damage, then I'm not going to be able to do that. But the thing is, I am trained to screen and say, okay, you're appropriate or actually you're not. And we can kind of get to that on, like I do a free phone call with everybody just to make sure that like I can help you, because I don't want to, entice someone in and then say, actually you're not a good fit. I want to make sure. Yeah.
Right. That's great. Okay, so people want to see you, they're curious, like how do they get in touch with you?
Sure. So connectpelvichealth.com is my website, and I'm on Instagram at Connect Pelvic Health. But yeah, my name's Brandie Freeman, so I'm pretty easy to find. But yeah, either one of those two ways would be great.
And they get a free screening first, right?
Yeah.
They talk with you first.
So I can do like a Zoom call or a phone call, and we go over what somebody's problem is, when it started, what it's keeping them from doing, what their goals are. You know, depending on somebody's goals.
Right.
You know, like if your goal's here and physical therapy, I know from my experience it's going to get you here. Then I'm going to say, hey, maybe you need to also see this person, or maybe, you know, go try this. And I'll just be I'm always very honest, because I want the best for everybody, you know. So, but yeah, we can have that phone call and then figure it out. And I am in Ackworth, but I go as far west as Marietta for home visits.
Okay, great. Well, thank you so much for your time.
Well, thank you, Doug. I appreciate you coming
All
by.
right, great.
All right, everyone, I hope you enjoyed that. As usual, I want to thank my patrons on Patreon, and let me know in the comments if you'd like to see more of these kinds of videos. Until next time, namaste and have a great day.